Greetings, I'm Dr. Catherine Y. Brown. As you know, I am on a journey to capture 100 voices of pulmonary hypertension. Today, I am super excited to have Joanne Sperando with us. Today is December 2nd, 2022, and our journey continues. So welcome, Joanne.
Oh, thank you for having me, Catherine.
I just want to say I appreciate you for being willing to share your story with all of our viewers around the world. We do hope that many people listen to the video and also the transcript so that they can learn and hopefully they find hope. And, that is really the theme here is awareness, empowerment, and hope, because we know that together we can make a difference. So thank you again for sharing your story. So let's get started. For our viewers, I would love for you to share where you're located and a little bit about your background in general so they know who is Joanne.
Okay. I am a 58-year-old woman living in Long Island, New York, in North Babylon. I graduated locally from college here, and my background was banking and some credit card work before I got diagnosed and eventually stopped working. But so far, so good, doing okay.
Very good. When did you first hear the two words pulmonary hypertension, and what was that journey like towards diagnosis?
Okay. Okay, so in my case, I heard the words pulmonary hypertension when in 1995, my brother John started fainting. He was 34 years old. He had rheumatoid arthritis, first person in our family to get that we knew of. But he started passing out whenever he exerted himself. So he went on this journey for about a year of going to various doctors, getting a bunch of different tests, until finally a cardiologist gave him an echo and saw that his heart was enlarged on one side and suspected pulmonary hypertension, and sent John into New York City to a specialist who gave him the ultimate diagnosis. When John got diagnosed in 95, that kind of jogged everyone's memory. And my mom said, my 23-year-old sister in 1963, she died very quickly within months after getting pregnant. She was a newlywed, life went on, she got pregnant and she passed. And mom just remembered it had something to do with the pulmonary artery. They pulled Aunt Josie's records and there were the words, they called it primary pulmonary hypertension back then. So then we realized that there was a genetic factor to our family's case of PH. When John was diagnosed, I did everything I could, learned everything I could. We joined PHA, we started making donations to research. John entered a clinical trial and his condition stabilized. We were very fortunate at that time. And then 3 years later, I started to notice all the symptoms in myself. And I received my diagnosis in 1998. And John and I went to the same doctor in New York City.
So when you started to recognize the symptoms, did you immediately knew to go to that specific specialist, or how was that process like?
Actually, the first thing I did was call my brother. I had moved to a very hilly area here on Long Island, and I could not make it up the hill without tremendous I had a lot of heart symptoms. I had shortness of breath, but a pounding heart, feeling like I was going to pass out. So I actually called my brother and he said, Joe, go, we need to get you to a cardiologist and see what they can tell us. So I found a local cardiologist, explained my family history, and he knew what to look for. And at the end, he said, yeah, you definitely, we think you have all the signs of pulmonary hypertension. And my brother we made an appointment at the hospital in New York with a specialist. And he took me there, and she diagnosed everything. And that, that once that ball starts rolling from diagnosis,
Mhm.
you're faced with everything, your choices, what drugs can I take? What do I do? But having seen my brother go through the whole process, excuse me, really, I was so much in better shape than folks who've never heard of PH, um, just completely unfamiliar with the illness, never heard of it. So that's something that I always think about, that I didn't have that huge shock that a lot of other people, like my brother did.
Absolutely. So when you got the diagnosis much quicker, which is it's amazing, right? To get the correct diagnosis.
Oh,
What
yeah.
were the treatment options for you? Was it different than like your brothers, or did you find that you all had very similar treatment options that worked?
Well, in 1995, there was only one treatment specific for pulmonary hypertension, aside from, things like blood thinners. Everyone goes on Coumadin, everyone takes digoxin to strengthen their heart. John was offered a spot in the clinical trial for the first PH drug. And that drug involved having a catheter implanted in your subclavicle vein, wearing a pump with ice packs, 24/7 infusion therapy. So, and that really worked for my brother. He was treated and began to do recover and do very well. It was 3 years later, so I was given a choice of what my brother went on, or there was a new clinical trial that was going on. That was for delivery of the medicine in subcutaneous with a much smaller pump, no ice, no implanted catheter. I just inject myself on my hip or my stomach, and the medicine infuses 24/7 subcutaneously. A lot simpler than having a central line like John did. So I opted to go into the clinical trial, and there were ups and downs, but I'm here 24 years later.
Amazing. I love that. And, in addition to those ice packs, there was that process of having to mix the medications, which was its
Oh,
own
yeah.
entirely. I mean, you almost turn into a medical supply store and getting trained on that. I mean, my mother
Yeah.
had the same one, so I know that one very well.
Yeah. My brother, I should tell you, Catherine, my brother fought PH and rheumatoid arthritis for 20 years. And he passed away in 2015. But I remember when he sat in front of our doctor at the time, he said, "Doc, I have a 3-year-old and a 1-year-old. Please tell me I'm going to see them grow up." And the doctor said, "We are going to do everything possible." So Johnny had 20 years, and then he passed. Um, I'm sorry, I lost my train of thought, Catherine. What did you say?
You know what? I was so into what you said. I forgot my question too, because I
I'm
was just
sorry.
thinking, even though when you were talking, I was thinking, I'm so thankful that he got those 20 years. I'm so sorry for your loss. It's never easy for us in this community, but the beauty that he got those years
Yeah.
of life. And for so many people prior to that medication, they didn't even get that. So I was just so thankful. When you were talking, that's what I was like, I'm just so thankful that he got that time. So that's a beautiful thing.
Catherine, I remember now. What I was going to tell you is that my brother was married to a wonderful girl who's a nurse. So his wife would do all the mixing, and John knew how to do it, but she just felt better controlling it. She was an immaculate. You have to be so careful when you have a central line. You're at risk for infection. So she took such good care of him, and we know that that is, sorry about the phone. We know that is why John got 20 years. So many patients don't get 20 years.
Oh, I just love that. So what is life like for you today? What is a typical day for you?
Life today is, I've had a few ups and downs over the years. I've had a few crises that, thank God, my doctors have brought me through. Unlike a lot of PH patients, I had open heart surgery. I needed a new pulmonary artery. I developed a pulmonary aneurysm. And while you really don't want to do open heart surgery on someone with pulmonary hypertension, my doctor felt this was absolutely necessary, and it was, because eventually it would have, burst. So I've had these crises. I worked for the first 13 years after my diagnosis. It felt good to just keep plowing through. But after 13 years, I started to have stomach troubles. That's a side effect from the medication. And working just became really, really hard. I would sneak out to my car to take a nap during my lunch hour. It was very difficult. So I made the decision to stop working and focus on myself, my community. I started a support group here on Long Island. We were the first group in the area. Met so many other patients and loved bringing people together, because it was the first time some PH patients, PH being so rare, it was the first time patients had even met another patient.
That's right.
Started that in 99, 2000, and the group is still going strong. I have co-leader. So I joined the national organization. I sat on the board. I really immersed myself in our community, participated as much as I could. We did fundraising, we did awareness raising events, trying to, get PH on the map. That's what we were doing,
Right.
trying to get PH on the map. I have I'm the blessing of a wonderful family and wonderful friends. I'm very lucky. It's still a struggle. Pulmonary hypertension is one of those things where you can't tell by looking at me that I'm sick, right? Except for my little scar here. But people don't realize that you're fighting a real monster.
That's
And
right.
so there are ups and downs. There are some days that I have to rest, that I don't have a lot of energy. I'm very good about seeing my doctor. There's always the possibility of a lung transplant in the future, so you have to always keep that in mind. But I do my best to go on. And some days are tough and some days are good. So you just have to embrace the good days and plow through the bad days.
I love it. I love it. I love your willingness to share your story, because I think people will learn so much from hearing you. As I was sharing earlier, our mantra is awareness, empowerment, and hope. Together, we can make a difference. So as you think about that mantra, is there anything that you would like to share that I have not asked you that will help maybe inspire someone? Because I suspect that there are going to be people that are newly diagnosed, people who aren't yet diagnosed, who are hearing about PH for the first time, and even medical providers who need to know that there are specialists, and sometimes a referral is the better choice for a patient. So I don't know anything that you would like to share, but I'm open to it.
Yeah. I can tell you that when newly diagnosed patients come to the group, they're like in shell shock. And I remember it so vividly. I remember what my brother went through, and I've met so many patients now. That first diagnosis period of time is very emotional. In my case, I was also 34, like my brother, when I got diagnosed. I knew immediately that I could not get pregnant. I knew that having a baby would have been a huge risk. In fact, my Aunt Josie died when she was pregnant. So your life goes from this to this in 1 second. And I think I encourage anyone who's newly diagnosed to seek out help, talk to any mental health professional about dealing with this huge change in life. I encourage new folks to to join an organization. There's 2 organizations that you can join. You can join both and participate. The fact that PH is so rare means that you have to become the expert. I have educated so many doctors when I'm in the ER.
Yes.
Absolutely. You, as a patient, you actually probably know more
About it than they do.
about the illness than doctors who don't specialize.
So
So I definitely encourage folks to seek out a PH center for treatment. Know what all your options are. Look into clinical trials. There's so much happening. And get involved where you are. Bloom where you're planted, they say. You can do awareness raising. You can speak to other patients. The online community, very organized. You just get involved. And for the medical professionals, I would say, if PH is not your specialty, definitely refer to a doctor that it is their specialty, because at that center there's going to be stuff going on that any PH patient would want to participate in.
I love it. Listen, Joanne, you have summarized it all so well. There's no need to summarize it. I just say thank you again. And I hope that anybody watching, you hear Joanne's words about sometimes you have to bloom where you're planted and you become the advocate. And it may not be something that you signed up for or thought that would be your journey, but for whatever reason, you've been called. And so just answering that call. Joanne, I did want to ask you, your aunt, how old was she? Was she in her 30s as well?
No, she was 23 years old.
Oh, you said 23, that's right.
Yeah, and what happens is, and the doctors have told me this, pregnancy is like a trigger. So we have the genes, we have the mutations that cause this illness, and pregnancy can be the trigger that brings it out. And unfortunately, 23 years old, 1963 was a miracle that she got diagnosed. In fact, John, my doctor, was shocked when she got the records from 1963 that said pulmonary hypertension. She said, this is a miracle that it was diagnosed.
It was diagnosed, wow.
Yeah.
Well, thank you again, Joanne, for being here with us. And for our viewers, please like this message, share this message. There's someone else who needs to hear Joanne's story. We have to work together as a community to increase awareness of pulmonary hypertension. And I tell people, our nonprofit, there are other nonprofits, we have to lock arms. It's going to take all of us. We are part of this village of increasing awareness of pulmonary hypertension. And we believe that one day there will be a cure. That's it. That's it. Fingers crossed. For our viewers, thank you again for joining. And until next time, you know that I'm on the road to 100 stories of pulmonary hypertension, and I am determined to get there. So I'm Dr. Catherine Y. Brown, your host. Thank you, Joanne.
Thank you, Catherine. Thank you so much for all you're doing.
Oh, thank you. I just appreciate you for being part of the bringing the vision to life, because it takes courage to even do this side of it. So thank you.
Thanks for everything, Catherine.